Hello, everyone, and thank you guys for joining us today for our question lab for our question dissection. Today, we're going to be doing question dissections on the topic of gastrointestinal. So glad you guys are here, and hopefully we'll all learn something, and it'll be a good use of your time. Before we begin, I do want to make some introductions. First and foremost, I want to introduce Dr. Paras Vakaria, who will be leading today's discussion. So Paras.
Hi, everyone. Nice to meet you. Looking forward to doing this dissection with everyone.
Wonderful. Dr. Vakaria is one of our coaches with RX Coach, and we'll talk about that here in a little bit. We also have some panelists who will be helping answer your questions. If you have any questions, you should see a question box there. You can type your question in, and our panelists will do their best to answer all of your questions. Mark, do you want to introduce yourself?
RX coaches. I'm a third-year medical student at Cooper Medical School with Rowan University, and I'm happy to answer any of your guys' questions.
Wonderful. So we've got some great panelists here for you today. My name is Sean. I've been with RX Coach for about a year. RX Coach is our new one-on-one tutoring program. As you guys know, everybody learns differently. We all have different strengths, different weaknesses. And so what we do at RX Coach is we make a plan that's individualized and caters to you personally. We help you make a personal study plan and then identify those strengths and weaknesses so that we can not only maximize your score while you're in medical school and on your board exams, but also to help you take a focused approach to studying so that you're maximizing your study efforts and seeing those results. And if you guys are interested in learning more about RX Coach, you guys can visit rx-coach.com and schedule a free consultation to discuss our tutoring program. I know a lot of people out there are we're all dealing with COVID, so I have a question for you guys, and I'm going to pop it up here on the screen. And if you guys would take a moment to please answer this. The question is, with the uncertainty caused by the spread of COVID-19, when are you planning to take step one? So we'll give you guys a minute to answer, and then we'll look at the answers here together and see where everybody is. All right, looks like we've got a good amount of answers here, so let's close this poll and take a look. It looks like a pretty even split here between our audience today. So, a lot of people are here and we're all, dealing with this together. Make sure that, if you guys have some downtime right now, make sure you don't fall behind and make sure you stay ahead of the curve. And RX Coach is a great option for all of you guys to stay up to date with your material and really get that expert coaching and tutoring service to help you maximize your potential on testing and get that residency that you're aiming for. So, without any further ado, we're going to go ahead and get into our question dissections. Today, we're going to be employing our practice that we use in RX Coach for question dissections, okay? So we'll be doing this methodically and step-by-step together with myself and Dr. Vakaria. Now you'll see here we have our first question, and you notice that the answer choices are gone, and that is intentional. We got rid of those for a reason because we don't want students to be distracted by the answer choices. We don't want their thought process when they're reading a question to be dictated by those answer choices. And we also don't want a student to see an answer choice and start panicking because they may not be too familiar with it. So we like to cover those answer choices up when we start a question, and we've already gone ahead and done that for you. Once we cover up those answer choices, what we'd like to do is read that last sentence out loud so we know what we're looking for when we read that vignette. So that is, which of the following is the most likely diagnosis? So we're looking for a diagnosis. On the exam, you're going to have one-step questions, two-step questions, and three-step questions. A good example of a one-step question is like this. We're looking for a diagnosis. A good example of a two-step question could be when we're asked to give the treatment for that diagnosis. A three-step question, an example of that could be when they ask us for the mechanism of action for a treatment for a diagnosis. So it's good to know and have a roadmap of how many steps you need to take to get to that correct answer choice. And this question here is a one-step question. With that being said, let's read this question together. Now, if you were in a tutoring session, at the end of every sentence, your tutor would be asking you, what would you like to highlight? What are you thinking? What are the clues you picked up on? Since we don't have time to do that today with all of you individually, I'm just going to pause after each sentence for a little bit so you guys can gather your thoughts. So with that being said, let's go ahead and read this vignette together. A 57-year-old man comes to the emergency department because of difficulty swallowing for the past 2 months. He says that he noticed gradual difficulty swallowing solid food, but over the past week, he has also had difficulty swallowing liquids. He is a lifetime non-smoker and drinks 1 to 2 beers on the weekends. Diagnostic testing via manometry shows absent peristalsis with high lower esophageal sphincter or LES resting pressure. A barium swallow reveals a dilated esophagus and an area of distal stenosis. So with that in mind, we read the question one more time, and that is, which of the following is the most likely diagnosis? And with that, I will turn it over to Dr. Vicario.
Thank you, Sean. So now we'll kind of review the answer choices really quick. And the key thing here is we like to have our students start from the very bottom. So start from answer choice E and then work their way up to answer choice A. And the reason we do that is so we don't get biased in the answer choices we're reading, and then we don't just pick an answer choice that we see from the top of the list and forget to go through all the answer choices. So this makes sure that this process makes sure that we go through all the answer choices and can think about each one. So I'll start reading from the bottom. Answer choice E, sclerodermal esophageal dysmotility. D, Plummer-Vinson syndrome. C, diffuse esophageal spasm. B, Barrett esophagus. A, achalasia. So we'll give everyone a few seconds to gather their thoughts, come up with an answer, and then if you could please go ahead and vote and select an answer on the poll. We'll give everyone a few seconds to do this. All right, and it looks like we are getting a good amount of answers. So we will go ahead and take a look at the results of the poll. And great job, a great number of you selected A, which is achalasia, and we will go ahead and uncover the correct answer, which is A, achalasia. So we'll briefly talk about this and dissect into this a little bit. So this is a patient who has noticed gradual difficulty swallowing solid food, but then developed difficulty swallowing liquids as well. This is what's known as progressive dysphagia, and this is characteristic of achalasia. On manometry, he's also found to have high LES pressure, or lower esophageal sphincter pressure, as well as absent peristalsis. Importantly, a barium swallow reveals a dilated esophagus with distal stenosis. This is characteristically referred to as the bird's beak. These are also both characteristic for A, achalasia. And so now we'll kind of review the other answer choices and why those were incorrect in this situation. And again, we'll kind of start at the bottom. E, sclerodermal esophageal dysmotility. This is seen most commonly in Crest syndrome, calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasias. It is characterized by decreased LES pressure and esophageal dysmotility. Considering that this patient has high LES pressure, this is unlikely to be the correct answer. Furthermore, there's nothing provided in the question that clues us in that this patient has other components of Crest syndrome. Answer choice D, Plummer-Vinson syndrome. This presents with iron deficiency anemia, dysphagia, esophageal webs, and a beefy red tongue. This has no effect on the LES tone, unlike in this patient. Additionally, we're not given any additional clues as well about a beefy red tongue or iron deficiency anemia in this case, so this is likely to be incorrect as well. Answer choice C, diffuse esophageal spasm. This can cause dysphagia, but this would have a corkscrew-like appearance on barium swallow, not the bird's beak type appearance that we saw in the question above. It may mimic a myocardial infarction, and it may present more with chest pain-like presentation, which is not exactly the presentation we saw here. Also, the LES tone would not be increased in diffuse esophageal spasm like it was in this case as well. So this is likely incorrect also. And then lastly, answer choice B, or Barrett's esophagus. This occurs due to long-standing gastroesophageal reflux disease, or GERD, that causes intestinal metaplasia in the lower part of the esophagus. However, we know that GERD is actually due to a decrease in LES tone that allows the stomach contents to reflux up into the esophagus. So considering that this patient in this case had a high LES resting pressure, this is unlikely to be the correct answer as well.
Excellent. So we got the first question under our belts, and we're going to go ahead and move on to question 2, following the same kind of methodology that we followed in the first question. So once again, you'll see that our answer choices are covered up, and remember that is by design. So let's go ahead and read that last sentence together. Which of the following additional laboratory findings would be expected in this patient? So this is a great example of a 2-step question, because first we have to figure out what's going on, and then we have to figure out what lab findings we would see in this patient. With that in mind, let's read the question together. A 43-year-old man of Eastern European descent comes to his physician with symptoms of worsening bloody diarrhea, cramping, progressive fatigue, and intractable pruritus. He has a medical history significant for ulcerative colitis. His vital signs are temperature of 98.8, blood pressure of 105/80, a heart rate of 103, respiratory rate of 20, and an O2 saturation of 98% on room air. Physical examination reveals a tired-looking man with scleral icterus. In addition to total proctocolotomy to alleviate gastrointestinal distress, the physician orders endoscopic retrograde cholangiopancreatography, or ERCP, which reveals alternating strictures and dilations in the bile ducts. Once again, with that in mind, we're going to try to answer which of the following additional laboratory findings would we expect in this patient. And with that, I'll hand it off to Dr. Vercaria.
Thank you, Sean. So we'll quickly run through the answer choices again, starting from the bottom and working our way up. Answer choice E, positive cytoplasmic anti-neutrophil cytoplasmic antibodies. D, positive anti-mitochondrial antibodies. C, elevated carbohydrate antigen 19-9. B, elevated alkaline phosphatase. Or A, decreased ceruloplasmin. So we'll go ahead and give everyone a few more seconds again, gather your thoughts, come up with an answer, and if you could please select one of the following answer choices on the poll. All right, and it looks like we've gotten a good number of responses in. We'll go ahead and take a look at the results of the poll. And looks like about 50% of people chose answer choice B, which is a great job, and we'll talk about this, but chose answer choice B of elevated alkaline phosphatase. We'll go ahead and uncover the correct answer, which is B, elevated alkaline phosphatase. So this patient is presenting with bloody diarrhea and cramping, which is consistent with the diagnosis of ulcerative colitis. However, his additional symptoms of fatigue, pruritus, and scleral icterus suggest that there is some biliary disease going on as well. And the biliary tract disease, most classically seen in patients with inflammatory bowel disease, or IBD, specifically ulcerative colitis, is primary sclerosing cholangitis, or PSC. So that was the first step, as Sean mentioned. This is going to be a multi-step question, figuring out what is going on, what is the diagnosis, and then figuring out what is the additional laboratory finding we would expect to see in the patient. So primary sclerosing cholangitis is a cholestatic disease, and it's diagnosed via a combination of clinical findings, laboratory findings, and radiographic findings. Laboratory-wise, an elevated alkaline phosphatase is most likely to be seen in patients with primary sclerosing cholangitis, which is why answer choice B is a correct answer here. Now we know that primary sclerosing cholangitis is characterized by inflammation and fibrosis, and then what you would see on ERCP characteristically are these alternating strictures and dilations within the bile ducts, classically referred to as a chain of lakes or beading. So that's talking about primary sclerosing cholangitis and why answer choice B is correct. Now let's quickly run through the other answer choices to review why those would be incorrect in this situation. So again, we'll start at the very bottom with answer choice E, positive cytoplasmic anti-neutrophil cytoplasmic antibodies. So in a patient with primary sclerosing cholangitis, in the context of ulcerative colitis, that is actually associated with positive perinuclear anti-neutrophil cytoplasmic antibodies, or p-ANCA, not c-ANCA as is listed in answer choice E. That's why answer choice E is incorrect. Answer choice D, positive antimitochondrial antibodies. These are characteristic of primary biliary cholangitis. Now I know it's very easy to get this mixed up with primary sclerosing cholangitis because two of the three words are the same in both of the disease entities, but it's important that we differentiate these two. This is usually seen, primary biliary cholangitis is usually seen in women, and they often have other autoimmune diseases. Furthermore, they wouldn't have an ERCP finding of alternating strictures and dilations. They have more granulomatous destruction of the biliary ducts. So again, this is why answer choice D is incorrect. Answer choice C, elevated carbohydrate antigen 19-9. This is usually found in neoplasms, especially pancreatic adenocarcinoma, as well as other GI cancers, particularly colorectal cancer. This is not represented by the presentation here, and thus this is an incorrect answer as well. Answer choice B was the correct answer in this case, so we'll go ahead and skip that, and then we'll move on to answer choice A, decreased ceruloplasmin. This is characteristic of Wilson disease. This is due to inadequate hepatic copper excretion. So you get accumulation of copper in various organs, your liver, your brain, your corneas, your kidneys, and your joints. So thus the symptoms and signs of Wilson's disease reflect that. So you would get asterixis, corneal movements, corneal deposits, or what's known as Kayser-Fleischer rings. And then you would also have low ceruloplasmin levels, which is characteristic of that. Since those signs and symptoms are not what we are seeing in this patient presentation, this is also an incorrect answer choice as well. Thus, elevated alkaline phosphatase, or answer choice B, would be the best answer in this situation.
Excellent. Thank you, Dr. Beccaria. So as you can see, we've done two questions so far, kind of going in a step-by-step methodical manner. And we're going to continue doing that with our third question. And in this question, Dr. Beccaria is going to, really point out some of those distractors to you as we're going over those answer choices. You guys can get a feel of how the test writer may try to distract you. So once again, you see our answer choices are covered up. And once again, that is intentional. So we'll read that last sentence first. Which of the following is most likely finding on radiography? Which of the following is the most likely finding on radiography? Once again, as you know, we have one-step question, two-step questions, and three-step questions on the step. This is going to be most likely a two-step question. We have to figure out what's going on with the patient and then figure out what we're going to see on radiography. With that in mind, and the fact that we know is a two-step question, let's read this vignette and see if we can't come up with the right answer. A 66-year-old woman with a history of cholelithiasis comes for evaluation because of generalized crampy abdominal pain. She noticed the pain 2 days ago on waking and says that it has been getting progressively worse. She has been nauseated and reports several episodes of vomiting without blood. She cannot remember her last bowel movement. On physical examination, she has poor skin turgor with tenting and dry mucous membranes. Her abdomen is distended and bowel sounds are hyperactive. There is diffuse tenderness to palpitation without rebound pain. An upright plain radiograph of the abdomen is ordered. And with those clues in mind, we're going to try to answer which of the following is the most likely finding on radiography. Dr. Beccaria?
Thank you, Sean. So we'll go ahead and read the answer choices again, starting from the bottom and working our way up. So answer choice E, thumbprinting. Answer choice D, pericolic stranding. C, air fluid levels. B, omega loop sign, and A, double bubble sign. So we'll go ahead and give everyone a few more seconds again. Gather your thoughts, come up with your answer, and then if you could please select an answer on the poll, and then we will go over the poll results. So I think we're getting a good number of responses into this poll. We can go ahead and take a look at the poll results. And what we're finding is about half of you chose answer choice C, air fluid levels. And we will go ahead and uncover the correct answer, which is in fact C, air fluid levels. So great job there, guys. So this is a patient that is presenting with generalized abdominal pain, and that's going to be important. Also with non-bloody emesis and constipation. She's dehydrated, she has a tender and distended belly, and she has, importantly, hyperactive bowel sounds. Also, let's keep in mind that this is getting progressively worse. It's not very sudden and acute. This presentation is most consistent with a small bowel obstruction, or SBO. Keep in mind as well that this patient has a history of cholelithiasis and thus are at risk of developing small bowel obstructions due to what's called gallstone ileus. So now the question is, what would we see on radiography with a small bowel obstruction? And the characteristic radiographic finding are air fluid levels as you guys selected, and that would be answer choice C. So let's go through the other answer choices and figure out why those would be incorrect in this situation. So again, we'll start at the bottom, E, thumbprinting. So this is most commonly associated with mesenteric ischemia. So the classic presentation is a patient who's coming in with severe abdominal pain that is disproportionate to the physical exam findings. What we found in this physical exam in our patient were actually pretty significant. With mesenteric ischemia, the pain is kind of due to ischemia as well as possibly infarction, kind of like an MI, but for the belly. And as we mentioned, this is a little bit more progressive and not very acute, and thus this is most likely an incorrect answer choice as well for this question. So now we'll talk about answer choice D, pericolic stranding. This is most commonly seen in diverticulitis. Diverticulitis presents with left lower quadrant pain. Keep in mind, our patient presented with generalized abdominal pain, not specific to the left lower quadrant. Diverticulitis also presents with fever and elevated white blood cell count, which we are not told here in this presentation. Furthermore, patients with diverticulitis often have a pre-existing history of diverticulosis, which we are not told in this patient. So given the constellation of the things that we were not told, as well as the fact that her abdominal pain was more generalized and not focused to the left lower quadrant, answer choice D is likely not the correct answer as well. We went over answer choice C, which is a correct answer, so we'll move on to answer choice B, or the omega loop sign. This is the key radiographic finding for sigmoid volvulus. So patients again present with acute abdominal pain and often present with obstipation, where they're not able to pass gas as well as not able to have a bowel movement. They also do present with abdominal distension and nausea and vomiting, as we saw in our patient, so this could be a tough one to differentiate. However, there are key risk factors for differentiating sigmoid volvulus from small bowel obstruction. Some of the risk factors for colonic or sigmoid volvulus include chronic illness, CNS diseases, laxative abuse and chronic constipation, previous abdominal surgery, none of which are present in the patient in this case. Also, and most importantly, this patient has a history of gallstones, as we mentioned, and we need to remember the risk of gallstone ileus and small bowel obstruction. And then lastly, answer choice A, or the double bubble sign. This is consistent with duodenal atresia. This is a congenital disease, so think infants, not a 66-year-old woman, as in this patient. So this as well is an incorrect answer choice, and hence why C, air fluid levels, is the correct answer in this question.
Excellent. So So far, we've done 3 questions. You guys have done a great job. It looks like we have a pretty sharp audience tonight. We're going to do one more question together, and then we have a raffle. We're giving away some stuff, and we have a very special offer for all of you guys, so be sure to stay tuned. With that being said, let's go ahead and jump into our last question of the evening. Once again, you will see here that the answer choices have been removed, and we are going to start, like we do, with the last sentence. Which of her medications is most likely to have contributed to her current presentation? Once again, we have to figure out what's going on with this patient and then figure out what medication could have caused that to happen. With that in mind, let's read the vignette. A 45-year-old woman comes to her primary care physician with a complaint of severe right upper quadrant pain, which manifested during the past 24 hours. The pain has been intermittent, and at its worst, she rates it as an 8 out of 10 on the pain scale. She also notes associated symptoms of nausea and vomiting. She eats a relatively healthy diet, largely comprised of salad and lean meat. Her temperature is 37 degrees Celsius or 98.6 Fahrenheit. Her blood pressure is 126/74. Pulse is 88 a minute, and her respiratory rate is 16 a minute. She's 5'2" and weighs 180 pounds. On physical examination, she has exquisite tenderness in her right upper abdominal quadrant. Her heart is regular in rate and rhythm, and her lungs are clear to auscultation and percussion. She is currently under treatment for hypertension and dyslipidemia. And with that in mind, we're going to try to answer which of her medications is most likely to have contributed to her current presentation. Dr. Beccaria?
Thank you, Sean. So again, we'll start with the answer choices at the bottom and work our way up. So answer choice E, pravastatin. Answer choice D, niacin. Answer choice C, lisinopril. Answer choice B, gemfibrozil. And answer choice A, ezetimibe. So we'll go ahead and give everyone a few seconds to gather their thoughts and then go ahead and vote on the poll, and then we'll talk more about this question. So I think we've gotten a good number of responses in. We'll go ahead and take a look at the results of the poll. And great job. About 90% of you answered with answer choice B, or gemfibrozil. And we'll go ahead and uncover the correct answer, which is answer choice B, or gemfibrozil. So this patient was presenting with intermittent right upper quadrant pain, as well as nausea and vomiting. It's also important to keep in mind the epidemiology. So this is a female. She's also in her 40s. And then when you look at her height and weight, she's also obese. Because she doesn't have any abnormal vital signs, and since the pain is intermittent, this is more consistent with cholelithiasis or gallstones. Anytime you have pain in the right upper quadrant, any kind of gallbladder pathology should be on your mind. So now the question is, what is causing gallstones here? That's what we need to figure out. It seems like it could be a medication, one, because that's what the question is asking, but two, that's really the main unknown variable here. They just tell us that she's on some treatment for hypertension and dyslipidemia. So what meds is she taking that could cause cholelithiasis? So gemfibrozil is a fibrate that's used for dyslipidemia, especially hypertriglyceridemias. Fibrates are associated with cholesterol gallstones. That's important to remember. They reduce cholesterol solubility and they reduce bile acid synthesis. So fibrate medications have place you at an increased risk of cholesterol gallstones, and hence why answer choice B is the correct answer in this question. Now let's quickly review the other answer choices and why they are incorrect in this situation. E, pravastatin. That is a statin medication, and that, as well as all the other statins, are inhibitors of HMG-CoA, and their main side effects include hepatotoxicity and various types of myopathy, which is not what we are seeing here. Answer choice D, or niacin. This is another lipid-lowering medication. Its main adverse effects include flushing, hyperglycemia, and hyperuricemia, which are not observed in this patient. Answer choice C, lisinopril. This is an ACE inhibitor, and lisinopril and other ACE inhibitors classically for side effects cause cough, angioedema, and hyperkalemia. We talked about how answer choice B is the correct answer in this question, so we'll move on to answer choice A, or ezetimibe. Ezetimibe is also a lipid-lowering drug, and its main side effects include hepatotoxicity as well, and then diarrhea also, which is both not seen in this patient. Thus, the correct answer choice would be B, gemfibrozil.
Excellent. Thank you very much, Dr. Vicaria. So as you guys can see, we went through 4 questions today, and what we'd like to do in our RX Coach, our tutoring program, and you guys met Dr. Vicaria today, who's one of our tutors, and Mark as well. We like to make sure that the student knows how to dissect the question, how to explain the clues, how to explain why the right answer is right, why the wrong answer is wrong. So we like to work on knowledge and content, but also sharpen those test taking skills and really help you make a customized study plan to focus your efforts in the right areas, ensure you're making progress, and maximize your results on test day. So if you want to work with an RX coach, a tutor like Dr. Vicaria or Mark, we have a great group of tutors. Please visit rx-coach.com. You can sign up there for a free consultation about our tutoring program, and we can explain to you the benefits and how it can help you achieve success like it has with so many of our students. If you have questions about how to make a study plan, or you have other questions, you can look at some of our amazing resources at firstaidteam.com. Make sure you guys stay connected with us. This dissection today, I hope you guys found it helpful. We're going to be trying to make this a weekly thing, and next week's topic will be on neurology. So be sure to stay tuned and connect with us on social media so you guys can stay up to date and see the things that we're working on. And we always have some great content there for you guys too. Once again, if you're interested in RX Coach, the website there is rx-coach.com. You're welcome to set up a free consultation, and we'd love to talk to you about our tutoring program and share some of the success stories with you.